First, I will say with Verax, what we're aiming to do is to make the invisible visible and the visible valuable. Okay, so that's how we are moving into that direction.
Welcome to Future Feed Talks. Detecting problems before they appear is the next frontier in livestock management. Today, we explore Verax, dsm-firmenich's blood-based early warning system for poultry and swine, turning biomarkers into actionable decisions that improve performance, welfare, and sustainability. I'm joined by Luis Valenzuela, Precision Services Manager at dsm-firmenich, who brings deep expertise in product innovation and market solutions that help producers achieve measurable results. This series is produced in cooperation with dsm-firmenich and All About Feed. My name is Iris Hoffman, and I'll be conducting this interview. Well, hello, Luis. It's a pleasure to do this interview with you.
Thank you. Hi, Iris. Nice to see you again after so long.
Definitely. Good to see you too. So let's start with what inspired the development of Verax and how does it differ from traditional diagnostic tools?
Yeah, so that's a very interesting question because we have a history of having analytics. So we have analytics inside the company. We use this analytics for NIR, for example, where you have calibrations to understand crops and to have what is the nutritional density and how we can formulate and so on. That's quite old science. But what it is important now is that that's okay, one of the science. Then we have also analytical tools in farm that veterinarians can use. They are blood biomarkers. But now with all the technology we have in the apps, we have realized that there was a gap. Okay, we have everything. We understand the nutrition of the crops. We understand also what happens with the birds through blood biomarkers. But we have a lot of data. We also have production data in the farms. We also know about pathologies that are happening. We can see symptoms. But how do they correlate? How do we understand that, right? So when we started a long time ago, our chief of innovation at the time had an idea. How about if we can do what we're doing in humans now? I don't know if you know, there are many companies now that they are doing this correlation of blood biomarkers and telling you what you should improve in terms of your nutrition, if you need to sleep more or not, etc. The idea was like, can we do that in animals? And then the company was like, yes, but that's not our market. And I said, yeah, no worries. We would like to co-develop this. And so it came out of that initiative. And so basically, in Verax, that's the name of the platform, we're trying to put all together. So we have machine learning models as well. We started with the broad range of blood biomarkers, and we narrowed this down to 17 now. So we work with 17 blood biomarkers. We have immunobiomarkers, and we have nutritional biomarkers. We use a set of machines that help us and enable us to utilize and do this blood sampling on site. And one of the coolest things about Verax is that as early as 24 to 48 hours, we can communicate to the farmer already or to the producer the issues they have, what they could improve, and they can immediately take action. So we're moving from a corrective way of doing things to a preventive way, because then he can also follow up these actions in the next flock. And if we catch this early enough, as one of our models that we have in Coxie is, then we could potentially also have an intervention in the current flock, which is not the aim. The aim is to do it towards the next cycle, but we could still do that at the beginning. So that's what it inspired us to do that.
Can you give me a little more insight how it turns blood biomarker data into actionable insights for producers?
Once we have the blood biomarkers and they come into our database, what happens, right? So we have an expert system, that's Verax, that is connecting all the dots. So we ask our producers to give us their farm data as well, their nutritional data, the veterinary practices they may have. Also, we input all the blood biomarkers, and then the expert system will start to do correlations. then these correlations are simulated and they are given as a result to us in an interface where you could see different models. So just to tell you, acid-base model, calcium phosphorus ratio, and several others, locomotion, enteritis, and so on. So now you have all this, and you have on top of that clinical observations, because when we do the blood biomarkers, you also do veterinary observations. Now, that veterinary observations, they're also input into the system. So once you have all this information, then we help our farmers to narrow down what actions they can take in order to improve their productivity. And you can tell me, yeah, but then we need them to have a bad performing flock. Not necessarily. When now talking about examples, we have worked with elite producers. When I say elite producers, are those ones that have a non-antibiotics or a few usage of coccidiostats. Their performance is on target or above target. They have an FCR of below 1.5, so it's a dream of a farm or a production. But even with them, we call them front runners, because they also want to push their own boundaries, and they also want to push the limits that they have. And we have managed to, even for them, help them to improve their uniformity. Why? Because uniformity is important for the slaughtering, for the processing of the meat, right? So the less disparity you have, the better will be for the slaughter, the better you will get paid as well as a producer. So these are the actionable actions that we have. And basically, also the system tells the producer, or tells us, look, these are all the interventions that we recommend. Because what the system does is, once we have all the biomarkers and once we have all the models, then it starts to also automatically evaluate what is recommended through peer reviews that have been curated already. So it's not all the peer reviews, but the most relevant. And then it starts to give recommendations. So one of the things that we have to do as a consultant, I have a double role. So one of them is consultant role for Verax, is that we need to guide and steer the conversation towards what recommendations are more relevant to tackle the 80-20. So the 20% of problems or issues that may help the farmer, and with that, we are mostly covered and they can improve their productivity. So this is how the platform is working.
So as a consultant, you work with farms to translate data into decisions. How does that go?
In a farm, in a production, you have multiple stakeholders. Once you have this data, once you have the recommendations, they tend to think that this is all veterinary interventions. And it's not the case. Giving you examples, sometimes, and it's also not that we are trying to sell our products. These platforms is really telling the farmer or the producer, black and white, these are your issues. This is what we should work on. Okay? So it doesn't matter if you have to buy a product from DSM or from a different company, but this is what you need to do. This is the intervention, right? We steer that conversation as well. But sometimes it can be the opposite. Sometimes as a nutritionist, I'm a nutritionist, we like to be on the safe side. So we tend to overdose ingredients sometimes. And we don't take into account sometimes also all the raw materials might be also increasing this ingredient indirectly, the content, the concentration. And so this is visible in the blood biomarkers. And sometimes we come and say, hey, by the way, we see that you might have an issue and your phosphorus levels are really high. Believe me, everybody wants to listen to something like this. Why? Because that action is immediate. They said, hey, lower the phosphorus. We do a recalculation, is lowered by how much? And they save a lot of money. So this is how we do it. That's the easy one. Now, the most difficult one is when you have different stakeholders in non-integrated markets. I think you're familiar with the Netherlands. Markets where you have independent farmers, independent hatcheries, a slaughterhouse, a feed mill, and all these guys, in a way, sometimes are not taking, I wouldn't say the blame, but the action, because it affects one, it affects the other. Who pays for that? So that's the game, right? So with Verax, we don't say, hey, it's your fault, No, we help them to understand that there are actions that can come from veterinarians. It can come from the formula, from the nutrition, And so the idea is to have them all together, that they understand the importance of what we are doing, and then everybody can collaborate and come to a decision. So it works. We are doing that right now. We are working also with Slaughterhouse, which we never thought that that would be one of our customers. So we are going towards that direction, involving multiple stakeholders, showing the data to them. They understand, okay, I need more uniform flocks. Can we do something in the feed? The guy says, okay, I'll do something in the feed. How can I be compensated by that? And then there's a dialogue, right? So instead of blaming, it's just trying to bring together all the parties and make a more cohesive production.
Can you share one example where Verax improved, for instance, performance, gut health, skeletal integrity, or business results?
Yes, one. Okay, not 10, but one. Yes. Actually, there are many examples, but like I was telling before, we were talking about blood. So we have been focusing about blood and what do we do with blood biomarkers. Now I would like to talk about the second part of Verax. That's the microbiome analysis. The microbiome part is not always done. Before we do a Verax session, we do an assessment with the customer. And if we believe that something might be triggered by a disbalance in microbial communities in the gut, then we tend to go and do a microbiome analysis. So this microbiome analysis, we take it from two samples. We do cloacal swabs or cecal content. I'm sorry, that's the word, cecal content. And we also now are trying to correlate the cecal content to a less invasive model that will be droppings. And so we're doing this correlation. So we have these two types of samplings. Then once we do that, what we want to understand is what is the impact of this microbial community also in the performance of the animal. Because sometimes, yes, the blood is telling you, and the blood will tell you, hey, you have an immuno-related challenge. And we say, okay, where is it coming from? And maybe we cannot pinpoint at the farm, okay, is this, is that. So it can also be biosecurity. That most of the cases, that's what happens. That's why we have a microbial imbalance. And sometimes it can be that it's something coming from the breeder flock. Okay, and this can be a bacteria that will cause something that we call a BCO lameness or bacterial chondronecrosis and osteomyelitis. That's driven by different bacteria, but the most common or the most known one is Enterococcus ecorum. And we have been able to isolate in many occasions these bacteria being the cause of these locomotion problems. So in one side, you can say it's a nutritional disbalance, but if we check also the vitamin D levels, for example, they are on spot, calcium phosphorus ratio is on spot. What else could it be triggering this? So it's likely that it's a bacteria, and we have already managed to help many customers. And that's why I choose this as an example, because it has been repeated in many customers. And you can see that we have a reduction of 12, 10, 25% on the incidence of lameness, which is a lot of, it's a lot of money in the bank. So they are very happy. And some of them are starting to go into a monitoring phase. So now they are not just with that service, but they would like to see what happens in the next season or what happens in the next year at the same time. If we do these interventions that you recommended, will it improve or not? And then we are now moving into this monitoring way of working with them.
That was a great example, thank you. And how does it help farms boost sustainability and improve animal welfare?
That's a good question. When we talk about sustainability, I also have in my role, I also manage Sustel in EMEA. That's our sustainability platform, right? But we're talking about Verax, so how does it relate to sustainability? I'm more practical, so I don't have the lingo and the well-versed like a sustainability expert is. So I just take what I do with my customers, and I said, where do we start? And when we talk about sustainability, what is the core of sustainability in animal production? Basically, is the nutrition. So in a farm, the footprinting of a farm mainly come from the feed. That's a big bucket. So if we can make this feed more efficient with the animals, then this relates to have better sustainability of the overall value chain, right? It translates into that. So if you have better productivity, if your animals are performing better, then we will lessen also the impact into the environment. So that's the second part of sustainability. So we drive sustainability from production and then towards the environment, right? And with the customers, what we say is, okay, we do Verax, we see what issues you have, we help you to maximize your productivity while at the same time taking care of your welfare. Because if you do something in this regard where the animals use better the protein, that translates in less uric acid going into or urea going into the field, so less ammonia deposition. That means less foot pad dermatitis, and that's better welfare. Also, not only for the animals, but now we also talk about the human, because the human that goes in has to breathe that air. And so if there's less ammonia, then there's less impact into the health of a human and also of an animal.
And last but not least, what is next for Verax in terms of technology, species expansion, and market reach?
Okay, first I will say with Verax, what we're aiming to do is to make the invisible visible and the visible valuable. Okay, so that's how we are moving into that direction. Now we understand all this, and we had as a first model chicken, so poultry breed, broilers. And the reason why we did it with broilers is because we could also do the veterinary part, the veterinary observations. Now we're moving forward, and we're moving into less invasive methods. So we still will rely on blood. Blood is like the gold standard for biomarkers. And then we're moving into breeders. We're moving into layers. We're moving into swine. So next year we are already doing pilots in a commercial phase for swine production. And then this is what is coming now for Verax.